I'm Brooke Abbott.
And I'm Amber Tresca, and we're the co-founders of IBDMoms. We're moms and inflammatory bowel disease patients, and we've created a safe space for other moms with Crohn's disease or ulcerative colitis to share their journeys with one another.
The IBD Moms podcast will focus on topics such as body dysmorphia, sex and intimacy, how to parent through a flare-up, and transitioning kids from pediatric care to adult care.
Thanks for being with us. We are here to help moms on the challenges they face on their journey through motherhood and chronic illness. Hey, Brooke.
What's up, girlfriend?
Well, we're here at Digestive Disease Week 2022, and I'm really excited because we had an amazing guest come and talk to us.
Yeah, she's a rock star.
Yeah.
I mean, let's be real.
Let's be real. Dr. Megan Riehl, who is a clinical psychologist, and she talked to us about body dysmorphia and body dissatisfaction and how that overlaps with IBD.
I think that's something that we, on many different levels, can all relate to, whether, we're pre-momming or post-momming or post-surgery or in the middle of a flare where we just can't control our weight, and just some of the things that go along with living with a chronic condition and not being able to control what's happening with your body.
Yeah. I think that it's something that we don't talk about often enough, or even at all, like ever.
Oh, no, never.
The way that she presented how we need to think about these things is really just amazing, and it opened up my eyes. So I hope it does the same for other people.
Also brought a little bit of relief. I'm grateful.
Yeah. Coming up next, our conversation with Dr. Megan Riehl. Dr. Riehl, I wonder if you would level set for us first and let us know what are body image dissatisfaction and body dysmorphia?
Yes. So we assess for this with our patients to get an idea of how they're feeling about their body. So body image dissatisfaction is going to be somebody that is feeling a certain kind of way about how they look, maybe how their body is feeling. And that might lead to some emotional feelings. It might cause them stress when they look in the mirror. It might cause them to think about what they're eating and how it might impact their body. It might have to deal with, after a surgery, changes in their body. Mm-hmm. Body dysmorphia is leaning more toward more of the psychological sides of intensifying that body dissatisfaction.
Okay.
Right? Mm-hmm. So you might have body dissatisfaction, and it's something that might be normal, mm-hmm. right? You may have had a surgery and your body has changed. Mm-hmm. You may be new to an ostomy, mm-hmm. and you're looking at your body going, I don't know about this just yet. And in therapy, we can address that. With body dysmorphia, you're thinking about it more intensely. It might be prompting more mood symptoms. It might be shifting your behaviors. Mm-hmm. And so it's also something very important that we have to really assess for and think about where are we going to go with treatment? Where are we going to go with resources?
Right.
So what are some signs that patients or caregivers can start looking for? Because it just sounds like this is something that is pretty normal for patients. And I'm just wondering, and I'm thinking back to my own time, after mm-hmm. surgery, what are some signs that we should be looking for before we make that appointment?
We want to talk about it, especially it's not just a gender thing, but women and men can both feel both of these instances of dissatisfaction or dysmorphia. And as providers, you want to be aware of this. You want to be asking just the simple question of, how are you feeling about your body? How are you feeling about any changes that have happened to your body? And that's going to lend to greater conversations, mm-hmm. right? To normalize that you might be feeling different in your body right now. And some patients and people are going to say, I get why I'm feeling this way. And I think, it's just going to take some time, and I might not be loving my body right now, but, maybe I know I'm going to start to feel better. So you might be looking at what are the outcomes? pros, cons, risk versus reward, self-love, resources around like who's providing you with support, which is another question you might ask patients, how are the people around you with some of these changes? Are you talking about it with your partner or your friends? So I think asking questions about how they're feeling, normalizing it, letting a person feel the way they want to feel. Like if they're not feeling great in their body, it doesn't mean we have to jump to like, oh, well, you have a eating disorder or, these are abnormal feelings about your body image. I think assessing the spectrum of time from change and giving people space and then providing resources.
I wish I had heard this postpartum.
Yeah, you're feeling some kind of way. You're feeling like maybe it's not normal to feel that way because it feels like something that needs to be addressed. But at the same time, it's also a normal part of that process.
Right. And part of body image, and this is where kind of society as a whole has a lot of work to do, right? So like, the body that we had at 16 is going to be different from the body we have at 29, right? Which is going to be different from the body that we might have after having babies.
Yeah.
And like bounce back, right? The bounce back effect that is so unfair. And yet that's what a lot of society pushes. And one thing that I talk with my patients about is like finding that self-love for the body that you have and embracing what your body does. And that's the same, whether you've had a baby or whether you've had a surgery for your IBD, like your body is still your vessel of like, we can love it at, that's what, like the healthy at every size ideas. Beth Rosen does a lot of work in that. She was a registered dietitian. So it's certainly in therapy conversations around like, what are the expectations that you're feeling from like maybe outside or like even what your body used to look like? Why do you feel the need to like go back to that? Let's look at what's healthy for your body right now.
Yeah. That bounce back is kind of interesting with IBD though, because sometimes, I remember that weight just shed, but I didn't feel healthy and I didn't actually like the way my body looked after I had a baby. And it was so rapid. And then everyone's like complimenting you, what did you do? Hey girl, you look good. Like, no, I don't.
The compliments.
Isn't that the spectrum?
I wish I was as skinny as you and things like that. And it's a little bit like, okay, but wow, am I sick?
So Amber, that's like this spectrum that I also see and again try to like validate for patients. So when you're feeling really, really sick and you are skin and bones and like you feel terrible, but yet, so much with IBD can be invisible. So you might still be going to work, you're still dropping the kids off at school, and that person says like, oh, you look so great, and you are feeling so terrible. And then the other end of the spectrum, right? You've done a course of prednisone or you've been on prednisone for however long and you've gained a bunch of weight. And I've worked with lots of people where they're like, I just can't shed it. I look at myself and I don't like it. Or I was on prednisone years ago and I still can't shed that 50 pounds that I gained. We have to acknowledge and validate that and talk about, that's a shift. And you could probably work out as much as you want and work with a dietitian, and this just might be the body you're living in right now. So how do we work through the emotions of that? The grieving is another big part of this.
Big part,
And helping patients to understand what that grief process looks like, and that those initial emotional symptoms of maybe depression or maybe anxiety or maybe worry or frustration, anger, that's all normal and healthy, and it's probably good that we process that and let you feel that. And then what does acceptance look like on the other end?
My thoughts immediately go to my kids on this subject. My kids don't have IBD, but it is something that I think about a lot in terms of meal times, what they're viewing on social media. They're now teen and teen adjacent, so I cannot know absolutely everything. Also trying to respect their privacy in that space a little bit. So it's a lot of balancing. How should we be thinking about this? And is there something that we can do as parents that can help our children navigate this kind of, ridiculous situation that society has set up for us?
So having insight into just that is a good starting spot, because nobody's going to do this perfectly. I'm a clinical psychologist, and sometimes I'll say things, that, and I go, oh, like, no, I don't want you to have that view. And so I think acknowledging you don't have to be a perfect parent, but having this idea that what people see on social media, what our kids are exposed to, what might be being said in other people's homes.
Oh, yeah. That's a big one.
That's huge.
So something I'll say with my kids is, in our house, this is our family value, or this is how our family looks at things, right? So I think a big part of this is it can't be black and white. I want my kids to be healthy. I want to try and feed them as nutritious of meals as I can, but they're going to have mac and cheese sometimes. I'm not kidding. And frozen chicken nuggets. And I'm a working mom. So it's about balance, and it's about me modeling, we have I drink water bottles, and and so I think the way we model for our kids that there can be moderation. There can be, you can have the chocolate cake and feel good about it, and then we can also have vegetables and fruits and I know that I'm coming from a place of privilege as well, and so I want to acknowledge that as well, that there are going to be families that have food insecurity and are struggling with how to navigate body image and healthy eating and access to things. And so I think that you have to, as a parent, we have enough stress. So knowing that you're just doing the best you can and that you are unconditionally loving yourself is going to be the best thing that you can do for your child. And I also acknowledge that's very hard. But I truly believe that when kids see that, also how we treat other people.
Right.
Oh, that's huge.
That if I'm talking about something that I think is beautiful, showing them that diversity and different races and ethnicity, and that is all something that's beautiful and healthy, and so it's a big question.
Yeah. I know. I'm like, Dr. Riehl, can you just solve this for me right now, right here?
So my answer is, that we just have to do our best and model.
We're talking about having conversations and making sure that we model good behavior and inclusivity, but what would treatment look like for someone like me or an Amber who may just be completely dissatisfied with how we look or how we feel? I feel like for patients, it's more so how your body makes you feel. I will just say that I was uncomfortable with my body after having a baby, but I was very proud that I was able to have a baby. Now, my body post-surgery, I felt very defeated and I felt a little out of place. And I think that was my biggest struggle. Not so much the scars and all the things that were going on and the rapid weight gain and the rapid weight loss. It was more like I had to have this big surgery because I failed myself. And that, I think, is the bigger thing to get over.
So that's the therapeutic, that's the roadmap, right? You knowing, I'm having these feelings, I'm recognizing this about myself. It might be really helpful to sit with, a licensed clinician in mental health to work through this specific issue, right? And that's what I love about my job as a GI psychologist, is that you might show up at my door just to go through that as a therapeutic process. You don't have to be in therapy forever. We might really work through that for a couple weeks, might be a couple months, giving you some, tools and strategies, a safe space to talk about that, to normalize some of those feelings that you're having. But then also if, we need to dive a little deeper into why or, how's, you're in the good hands of a licensed mental health provider. And then, oftentimes you have the growth and the movement through that. And therapy is short-ish. It's different. It's different than a more long-term therapy, though that certainly can be beneficial too. But I think that's a big thing I talk about with people is you don't have to be in dire straits to work with a mental health provider.
Okay.
I think that's important, super important.
And also just to acknowledge that, sometimes there's body image dissatisfaction or dysmorphia without an eating disorder, but we want to be careful that how you're feeling about your body doesn't then start to lean into you're making alterations in your eating. And we all, we know that there's a very big complexity around GI conditions and eating. Sometimes you're not eating because it makes you feel bad. And so the sooner you can get yourself that support, the quicker we can get you the resources and get you feeling, through, I don't even say like feeling better, but generally speaking, getting to a place of acceptance with, this is the body you have right now. And how do we get you feeling okay with that?
Do you have any resources that you'd like to direct patients to that they can find out more information or they can find a psychologist or someone to work with?
There is the Rome Gastropsych directory that's online, and we can give you a link for that, certainly. And then if there's not a GI psychologist in your area, I would recommend either talking with your primary care doctor or your gastroenterologist, who may have a directory of local people that they have a working collaborative relationship with. And you can also use psychologytoday.com. I do encourage you to put in, there's a way to kind of filter through and locate people that you're, and body image is one that you can click on. And you can also, chronic illness is another filter that you can put on there, and you put in your insurance, your zip code, and it will direct you to providers in your area.
Oh, nice. That seems, I love something very simple that I can kind of pull up during, carpool.
Yeah. Dr. Riehl, you're a mom. Tell me about your kids. What are they into right now?
I have very active little boys, 5.5-year-old and a 3-year-old, and they are buddies, but also I'm covered in bruises because I'm when we're playing hard, and that's fun, and that can be a challenge and exhausting, but they are super fun. And now that it's starting to get warmer outside, we're outside a lot. So bike riding, my 5-year-old just took his training wheels off. So that was like a mom moment.
Yeah,
I did not
huge.
expect to feel like such an immense amount of pride watching this little 5-year-old, crookedly riding down the sidewalk. So that's been super fun. And then I have an 11-month-old daughter. And so I went from a boy mom to now like a mom of 3. And she is just starting to toddle around. So again, taking those, I call her my scaler. She just scales through the walls, anything she can walk to hold on to. And then she's taking some steps. So I'm busy, and there's a lot of noise. My house is so loud, but it's true. There's lots of love. There's lots of love, and it's we're looking forward to the summer being outside.
Yeah. That's amazing. Thank you so much for all you do for IBD patients and for saying yes to us and coming and sitting with us during a very busy time at DDW 2022 and letting us know a little bit more about body dysmorphia and body dissatisfaction and how we can be on the lookout for that. Would you please also remind us, though, of your social media so that everyone can follow you? I do very much enjoy your social media, by the way, especially your Instagram.
Thank you. Both Instagram and Twitter are at Dr. Riehl, DRRIEHL. And engage. I love, that's what's great about social media. And I feel like I know you two a lot better. And so sitting here, and I also want to say thank you to both of you for all the advocacy work you do. It's a true blessing to our field.
Well, that just warms my heart.
Seriously. And it was really, really great after not seeing you for 3 years
Yes.
to connect with you here today. So thank you so very much for sitting down with us. We really appreciate it.
You're welcome.
Hi, this is Jax, and you're listening to my mom, Brooke Abbott, and my aunt, Amber Tresca, on the IBDMoms podcast. Please don't tell her I think she's cool.
All right, Brooke, I have to tell you about this thing that my kids were telling me about, the cool teen slang that they're using. Okay. All right. So they're apparently using this thing that you say, oh, that's cap. Have you heard of this?
Yes.
You've heard of it?
Yeah.
Okay.
Yeah. It's no cap. Oh, that's cap. It's just, it does not make any sense to me.
Well, I'm going to explain it the way that it was explained to me. And it's cap, C like Charlie, A like apple, P like patient. Okay. That's the first thing that I needed to understand. Okay. So my kids are telling me that it's basically like you're lying. Mm-hmm. So somebody will be like, I'm going to stop drinking coffee tomorrow. And then you would say back, like if you said that to me, I would say back, like, that's cap. Right?
Yeah, like you're capping. I don't understand it.
Oh, is there capping?
Yeah.
Capping.
Yeah.
Verbing.
So it actually started off as like an urban thing with young adults.
Yeah.
I still don't understand it.
Well, and the, I guess I get it. I guess I understand it. I just don't know why they needed another thing for that.
You don't. and also I mean, there are some sayings that I feel very confident in saying. I stumble on that one.
I don't think I'm going to use that. I don't think this is for me.
I don't think it's for me either. I feel like that belongs to the children's. Mm-hmm. I think that's a Gen Zer thing, and I'm going to let them marinate in that because cap and no cap, like even my younger brothers who are also millennials like me, when they say it, I'm like, ooh. I don't know about that one. I think that you should leave that to the Zers.
To the younger.
Yeah. Yeah. The no cap, that's cap, capping.
Yeah, right. I didn't know about the capping. Okay. But I knew about the no cap, that's cap. Or yeah. So the no cap, you'd be like, I didn't have any coffee this morning. No cap. Like I'm not lying. I'm telling the truth. Okay. It's, and then not only that, but this is what I'm told. People will then use the emoji. So they will use the cap and what I would call a baseball hat, I guess, and send that back. So if somebody says something to you, you would send them the cap emoji back. And that would mean that you're like, oh, you're lying or that's not true or whatever. Or you're kidding.
I got that back from the kid.
No.
Yeah. So that's how I started really hearing it.
Okay.
Because I had said something to him or asked him to do something and he replied. And then I said, are you sure? And he sent a no. It was the no sign with a circle with a line and then a cap next to it. And I was like, it took me a minute.
Yeah.
Shh, don't tell anybody. But it actually took me a minute to figure out what he was saying. And that just made me feel old. So I don't like capping. I want to use slang that I can use in everyday life, and I'm going to need that.
I think I'm not going to use it. Like I'm not going to use it when I text you, but I think I'm going to use it incorrectly or ironically to my kids.
As you should.
Because then I will get the mom stop.
It's your right.
Yeah.
Yeah.
So the next time they text me with something random or a question, oh, no, I'm going to wait for a question. I'm going to wait for a question that's about something that they want or they want me to do. Take me to my friend's house, pick me up, yada, yada. And I'm just going to text back a cap.
Mom, stop. I'm so grateful to Dr. Riehl for joining us today. She gave us so many great tips on how to thrive through the struggles of dealing with body dysmorphia.
She really opened up my eyes to a lot of different things. I'm also so glad that we asked her about our kids.
So guys, in case you didn't know, this was our first episode. Amazing, right? I'm super proud. And just in case you didn't know, there are links to a written transcript, everyone's social media handles, and more information on the topics we discussed is in the show notes and on the episode 1 page on IBDMoms.org.
And of course, you can follow us across all social media as IBD Moms.
IBD Moms podcast is written, produced, and directed by the IBD Moms, Amber Tresca, and me, Brooke Abbott.
Mix and sound design is by Mac Cooney. Theme music is from Cooney Studio.
I was going to say by the IBD Moms podcast.
So,
don't kill me, Mac.
I will edit all of this out. Except maybe that part.